Bipolar. Have you ever heard of it? Well, bipolar is a mental illness which causes the person to have severe high and low moods, changes in sleep, energy, thinking, and behavior. Let's start off by talking about the recent government mental health initiatives. So the government has created an organization called Black Dog Institute. Today we have a representative of this organization. Hi John, how are you today?
Hi Joey, I'm good thanks, how are you?
I'm great today. Well, let's get down to business and talk about what you came in here for. Would you like to introduce yourself?
So as you listeners know, my name is John and I work at the Black Dog Institute. I've been working there since the opening in 2002. We are based in Sydney, Australia and they're a non-profit facility.
Thanks, Jenny, for that beautiful explanation about yourself. Okay, can you tell us the aim of the organization?
Well, the aim of this organisation is to diagnose, treat and prevent mood disorders, such as depression and bipolar disorder.
That is such a big problem, isn't it? Another question is, what facilities does this organization offer?
Bipolar disorder is an illness which can require long-term treatment. We have a one-on-one non-medication treatment program. Physical treatments and psychological approaches by themselves are not sufficient, but alongside drug treatments serve a valuable complementary role.
Thanks for this, Jenny. You can leave now. Okay, so let's talk about some stats about bipolar in Australia. The lifetime risk of bipolar disorder is up to 5%, with rates higher in women. Early onset of bipolar disorder in childhood is rare. The most common risk period is in mid to late adolescence. Amongst people with bipolar disorder, there is typically a 10 to 20 year interval from the first mood episode to diagnosis. At least 1 in every 100 people experience bipolar disorder at some time during their life. Approximately 1.8% of males and 1.7% of females have had bipolar disorder in the previous 12 months. 3.2% of males that are 16 to 24 years old have had bipolar, and 3.6% of females who are 16 to 24 years old have had bipolar disorder in their lifetime. Overall, about 50% of people who have developed bipolar disorder will do so by the time they are in their early to mid-20s. My view on bipolar disorder is that it is such a serious topic and should not be treated lightly. To identify if you might have, listen to the following symptoms: feeling unusually high and optimistic or extremely irritable, sleeping very little but feeling extremely energetic, talking so rapidly that others can't keep up, racing thoughts, jumping quickly from one idea to the next, highly distractible, unable to concentrate, impaired judgment and impulsiveness, acting recklessly without thinking about the consequences, delusions and hallucinations, and that is only in severe cases of bipolar. Thanks for listening to this podcast today, and we hope that you have gathered a lot of knowledge so you're able to look after yourself and loved ones in case they are showing symptoms of bipolar, and then you can help them out.